my name is Summer Mattingly, and Becca Newberry and I did our qualitative research study critique on health-seeking challenges among the homeless youth. The first question is, the problem clearly stated and is significant to nursing or healthcare. The objective of the study is to explore homeless young adults' perspectives on barriers and facilitators of health-seeking behavior and their perspective on improving existing programs for homeless persons. It was clearly stated throughout the research article, the problem is homeless youth have challenges in seeking health care. It is imperative for homeless young adults to have access to not only health care, but also to preventative examinations to reduce the risk for developing chronic illnesses and diseases. When homeless young persons are in stasis or well integrated into the street culture, accessing health-related services is not a priority. However, in the stage of disequilibrium, crises are frequent and is in crisis mode that the homeless seek mental health care. What are homeless young adults' perspectives on facilitators? When homeless young persons are in stasis or well integrated into the street culture, accessing health-related services is not a priority. However, in the stage of disequilibrium, crises are frequent, and it is in crisis mode that the homeless seek mental health, drug abuse, and medical services. This is significant to nursing because this population is in critical condition by the time they seek our medical help, prolonging their hospitalization and recovery time frame. The second question is, the purpose is clearly stated. The purpose of this article was to gain further understanding of perceptions of homeless youth regarding their healthcare seeking behaviors. This purpose was clearly stated throughout the article and easily identifiable to readers, which is consistent with a qualitative study. The third question is the research question stated broadly enough for a qualitative study. The research questions are stated broadly, making it a qualitative study. According to Hudson, the research questions are: what are homeless young adults? Perspectives on facilitators and barriers to receiving health care? And how can existing homeless youth and young adults centered healthcare programs be improved? These particular researchers developed questions that participants can answer in a variety of different ways. The research objective includes the word explore, which is a common theme among qualitative studies. Number 4 question: is the study design consistent with its qualitative approach? When reading an article, it must have a broad framework, making it a qualitative approach. Qualitative researchers plan for broad contingencies that may be expected to pose decision opportunities once the study has begun. The framework used within this research study includes situational factors, which are homeless among young adults, your available resources, which is social support, financial security, and physical and emotional health, and finally, provide some understanding on how homeless young adults might view facilitators and barriers to receiving the health care. The questionnaire used in the research study consists primarily of exploratory questions related to the population of young homeless people. Number 5 question: are the subjects obtained using a method consistent with the qualitative methodology? The method that was used to obtain this data consisted of semi-structured interviews. The researchers used a descriptive methodology focusing on the characteristics of the homeless teens. Finding relationships between the variables. This study was conducted without applying interventions to the study group. This study is researching something that already occurs and is not controlled. The number 6 question is the setting appropriate for this study? The semi-structured interviews occurred at a drop-in site that the participants attend frequently. According to an additional research article, Kelly and Caputo, homeless youth often find shelters in flop houses, emergency shelters, and other forms of temporary or marginal shelter. The interviews occurred in a familiar place to the participants. Conducting the interviews in a setting that is familiar to the participants decrease the risk of additional variables, causing biases and skewing the results from the study.
As previously stated, the purpose of the study was to gain a better perspective of homeless youth and their health-seeking behaviors. So question summer 7 asks, are the data collection methods consistent with the purpose of the qualitative approach? Data collection was procured by interviewing 24 young homeless people who often visited a homeless shelter in Santa Monica, California. Those participants were placed in smaller groups of 4 to 6 each, and each only attended one group, and the group was chosen by the participant. Both at a UCLA researcher or California Institute of Arts faculty and a homeless young adult who was on the Community Advisory Board conducted each focus group. This data collection was very appropriate as it occurred in the participants' own setting. A peer of the participants was present to provide familiarity and comfort, and the interview questions were modified to be culturally sensitive as well as pertinent by the members of the Community Advisory Board. The interviews were recorded instead of the researcher making notes. Recording data is a more reliable and accurate method than taking notes alone. Are the rights of human subjects protected? The participants' rights were protected. They were educated about the nature of the study by the research staff, a consent form was provided and described in detail, and they were able to create a pseudonym to protect their identity. Participants did not face any undue harm while participating in this study. Is the evidence of the data saturation provided? Evidence of data saturation included the emergence of several themes. These were issues they experienced in accessing healthcare, unmet needs, stigmas or discrimination, and barriers that homeless people face. The emergence of these themes demonstrates saturation as interviewers revealed trends and common occurrences amongst the participants. Are the data analysis procedures appropriate for the type of data collection and the qualitative method? Data was extracted by transcription and content analysis of the focus group recorded sessions. Each line was coded using focus codes by research assistants. Data was also reviewed with the CAB members. What is that? CAB members to ensure trustworthiness and dependability. Categories and data were also reviewed by 2 research staff and an experienced qualitative researcher. It is sometimes recommended that a single person code the entire data set to ensure the highest possible coding consistency across interviews or observations. Having several people code may have caused some inconsistencies in the data collection. According to Horsborough, it is also important that the researcher acknowledge their responsibility for editing and selection of material. Is there sufficient evidence of scientific rigor? Scientific rigor for this research study was evidenced by the use of semi-structured interview guide that was used during the focus group sessions, and specific quotes from participants were provided supporting the various themes that emerged from this study. The research study did have structure, and participants met specific criteria to be included in the study. These criteria were 18 to 25 years in age, self-reported street youth, and reported drug abuse in the past 30 days. Are the conclusions and implications appropriate and clearly stated? The conclusion is clearly stated in the discussion portion of the article. There are many barriers to receiving adequate health care amongst young homeless youth. These include limited clinic hours, long wait times, conditions that receive priority care, inadequate care for chronic conditions such as asthma or migraines, and discrimination and lack of insurance. Are there suggestions for future research included? Yes. Suggestions for future research are the differences in health service utilization amongst different homeless youth of varying ethnicities.